Being a midwife means we're part of that initial journey into parenthood. So we've got quite a big multidisciplinary team. We've got our obstetricians as well as our anaesthetic team and our allied health professionals too. So it's a big group effort to make sure that this woman and their support people are cared for during their time in their labour and birth. Family clinic is where our families come in for their antenatal clinics. That's where they get antenatal education as well. So it then prepares them for what will happen over their antenatal journey, what will happen when they come into labour, when they birth, and then what will happen in their postnatal period and how we can then provide care from that. Being a midwife in the birthing and assessment unit, we get to be involved in bringing new life into the world, which is such an amazing job. Special care nursery, they look after our babies that need a little bit of extra help, need to stay in hospital for a bit longer. We've got an amazing team of midwives, nurses, lactation consultants, paediatricians that then help these babies get ready to go home.
As a paediatric doctor, my role is to meet children of all different ages and provide care to families of diverse backgrounds. I love listening to patient stories, providing comprehensive assessments for children, and also formulating management plans for children to help them recover as quickly as possible, but also addresses their general health as well. We work within a multidisciplinary team of nurses, doctors, pharmacists, place specialists, allied health, to make sure that we give patients the best possible care. Then we also have an outpatient service, which is run by both consultants, registrars and RMOs, and we see patients for lots of different reasons, including growth, development, behavioural issues. And at NALHN, we recognise the importance of acknowledging the specific challenges faced by Aboriginal children and their families. And we really try and tailor our approach to make sure that their needs are met. My goal is to make sure that the patient's journey through the hospital is as comfortable and as positive as possible, and that we do everything we can to make our families feel well looked after.
NALHN ED has a large group of nurses that work, over 200, and emergency doctors. We work together, provide patient care. We also work with a large group of allied health and multidisciplinary teams. When somebody arrives to the emergency department, the first person they'll see is the triage nurse. If they're not requiring urgent resuscitation, the triage nurse will give them a score based on their complexity and how time critical their presentation is. If they're presenting to the department with a complex presentation, they'll be allocated to an area to facilitate their care. If they're presenting with something more minor, they'll be facilitated to an area where we manage that. If patients are waiting in the waiting room, they do get regular observations and regular assessment. Our nursing staff will escalate any issues or any deterioration in that patient. From there, they'll go into a cubicle, they'll get seen by one of our emergency doctors and be looked after by our nursing staff. After they've had their investigations and a diagnosis is made, they'll be allocated to either discharge planning and going home, or they'll be admitted to one of our wards.
Our team helps provide specialist assessment, treatment and interventions for people that have a mental health component to their presentation. Patient journey is the core of the business and the service that we provide. This can either start with a phone call to mental health triage, or a presentation to an emergency department, or a referral from a general practitioner to a community mental health team. The mental health services spend time with that consumer, getting to understand their particular circumstances, how it's affected them, and what goals they want to achieve as part of their recovery journey. In NALHN, we like to provide a range of services to tailor to each person's preferences and their circumstances. The best part of my job is the people that I work with. They're fantastic, they are special, they care about what they do, and they do it with joy and they do it with heart.
Our service is for the older person in the catchment of NALHN. So the older person will present through ED. Their journey will take them to the wards if they need to be admitted, and from there we make first contact with them and then see them in their home, so the journey follows through to when they're discharged from our service. So we're a team of nursing staff, we've got geriatricians, allied health staff, which include physiotherapists, occupational therapists and dietitians, and we all work collaboratively together. We're part of the first step when they first come home from hospital. They may have been in hospital for a short period of time or a long period of time. Job satisfaction is great for me. I love hearing their stories about where they've been and what they've achieved. Really lovely to be able to provide that service to the patient.
I think it's important to see people in their own home so that you have the broader context of who they are and what's important to them. It's much easier to provide relevant support and recommendations when you see how they live their lives. So occupational therapy often starts in hospitals, so patients that present to ED or are admitted will often be seen by an occupational therapist, and the therapist will determine what they'll benefit from and what requirements they have for discharge. I'm really proud to work at NALHN, and it gives me great satisfaction to deliver services to the aged care community to keep them at home safely.
When we talk about the patient journey, I would recognise it's not just around treating disease and symptoms. It's about supporting the person and those caring for them. In palliative care, the patient journey doesn't end with the death of the patient. It continues into the support of their family, following up with bereavement care, providing a memorial service some 6 to 12 months later, where families can come together and remember and ask questions of the team. The beauty of NALHN, and the reason I have chosen to work at NALHN, is because we see the people and the families behind the illnesses. We do our absolute best to try and support our patients to live and die where they wish, whether that be in hospital or at home.
Everyone has a story.
Everyone matters.
Everyone contributes.
Everyone grows.